A heart attack and anxiety can both manifest with similar symptoms, but they are vastly different conditions. One being a life threatening medical emergency, the other a psychiatric condition that, while distressing, is not immediately dangerous. Symptoms of a heart attack may include intense chest pain, shortness of breath, and discomfort in the upper body, while anxiety often comes with a rapid heartbeat, a sense of impending doom, and panic, which may or may not include chest pains. Determining whether symptoms are due to a heart attack or anxiety can be challenging, but is crucial, as the former requires immediate medical attention. Treatment for a heart attack typically involves medications to dissolve clots, surgery to restore blood flow, or lifestyle modifications, while anxiety is generally managed with therapy, medication, and self-care practices. Risk factors for heart attacks include age, lifestyle, and underlying health conditions, whereas anxiety risks can be influenced by personal history, stress levels, and genetics. Here is a look at the detailed aspects of distinguishing between heart attack symptoms and anxiety. Symptom onset, acute versus gradual. Heart attack symptoms typically present suddenly and can be severe from the onset. Patients might experience an abrupt feeling of chest pressure, pain spreading to the arm, back, neck, or jaw, shortness of breath, and other sympathetic reactions such as sweating or nausea. On the other hand, anxiety symptoms tend to develop more gradually and can manifest as a chronic condition. Anxiety might produce chest pain, palpitations, and shortness of breath too, but these symptoms often fluctuate in intensity over time and are commonly coupled with prolonged periods of worry, tension, and nervousness. Differentiating between the two in the moment is critical, as a heart attack requires immediate medical attention, while anxiety, although distressing, is not life-threatening and can often be managed with long-term treatments like therapy and medication. Nature of pain, squeezing chest pain versus non-specific discomfort. When distinguishing between a heart attack and anxiety, the nature of the pain can be a crucial indicator. Heart attack pain is often described as a squeezing, crushing, or pressure-like sensation centered in the chest, occasionally radiating to the jaw, neck, or arms, and might be accompanied by shortness of breath, cold sweat, and nausea. In contrast, anxiety-related chest pain tends to be more diffuse, lacks a clear pattern, and is frequently accompanied by hyperventilation and a sense of impending doom. However, the overlap of symptoms can be confusing, making it paramount for anyone experiencing chest discomfort to seek immediate medical evaluation, as prompt treatment for a heart attack can be life-saving. Associated symptoms, physical versus psychological. Heart attacks and anxiety episodes share common symptoms such as chest pain, heart palpitations, and shortness of breath, making them difficult to differentiate. However, physical signs such as pain radiating to the arm, jaw, or back, accompanied by nausea, cold sweat, and fatigue, are more indicative of a heart attack. Anxiety, contrastingly, is often accompanied by psychological symptoms including intense fear or panic, feelings of doom, and sometimes hyperventilation. Anxiety doesn't typically cause the sharp, crushing chest pain associated with heart attacks, but may cause muscle tension leading to discomfort. Accurate diagnosis is essential, as mistaking one condition for the other can have serious consequences. Immediate medical evaluation is recommended when these symptoms arise to ensure timely and appropriate treatment. Triggering factors, exertion, rest versus stressful situations. Heart attacks and anxiety can present with remarkably similar symptoms, such as chest pain, palpitations, and shortness of breath, making differentiation challenging. A critical aspect lies in their triggering factors. Heart attack symptoms typically occur upon exertion or may even awaken a person from sleep. They can be relieved by rest or medications like nitroglycerin. Anxiety or panic attacks, conversely, often arise during stressful situations or periods of emotional distress. They may also happen out of the blue, but are not typically exercise-induced and don't improve with rest. Noticing patterns related to these events is essential. In heart attacks, physical triggers dominate, whereas anxiety is more tied to psychological triggers. Response to medication, relief by nitroglycerin versus relief by anxiolytics. Differentiating between symptoms of a heart attack and those of anxiety is crucial for appropriate treatment. A key distinguishing factor lies in the response to medication. Nitroglycerin, a vasodilator often prescribed to manage angina, can bring significant relief to individuals experiencing a heart attack due to its ability to improve blood flow to the heart. On the other hand, individuals suffering from anxiety might find little to no relief from nitroglycerin. Instead, they may experience symptom alleviation when treated with anxiolytics, which are medications specifically designed to reduce the physiological and psychological symptoms of anxiety. Monitoring how a patient responds to these types of medication can be an informative component of the broader diagnostic process, helping healthcare providers differentiate between cardiac distress and anxiety, thereby guiding more accurate and effective interventions.